Hello everyone. So today topic of discussion is Dexa, which stands for Dual-Energy X-ray Absorptiometry. It is the gold standard investigation of osteoporosis. Osteoporosis means osteo as bones and porosis as pores. We have two types of cells. One is osteoblast and another is osteoclast. Osteoblasts are bone forming cells, whereas osteoclasts are bone destroying cells. So when there is a decrease in osteoblast count and increase in osteoclast count, we have a condition known as osteoporosis. We can also frame it as when there is a higher breakdown of bone in comparison to the formation, we call it as osteoporosis, which overall result in decrease in the bone density. We have another term known as osteopenia, that is the loss of bone mass and weaker bones. Typically, it is a precursor to osteoporosis. So in this image, we can see the healthy bone and the osteoporosis, where there are lots of pores inside that bone. During a normal X-ray, suppose of our hand, X-rays are coming from one particular direction. But in Dexa, the word dual means from one particular energy of X-ray is exposed from one side and another particular energy from the other side. So rays are coming from two different directions. That is why the word dual is used. Rays are coming from two different directions. It is traveling certain mass and it is also occupying certain volume. So the mass is the mass of the mineral, which is expressed in kg, and the volume occupied, which is expressed in cubic centimeter. And as we all know, mass of certain thing by volume is density. Here we are talking about mass of the mineral, so we are calling it as bone mineral density, BMD. Dexa measures the density or thickness of bones and the amount of calcium in a specific bone. We have formula for average bone mineral density, which is BMC divided by W. BMC stands for bone mineral content expressed as gram per centimeter. W stands for width at the scan line expressed in centimeter. The basic principle of Dexa is the measurement of transmission through the body of X-rays at two different levels of energy. One is high and another is low. X-ray source generates a beam of X-rays, and this beam of X-rays are attenuated during the passage through the tissue, and the attenuation is influenced by the intensity of energy and density and the thickness of the human tissues. So as we all know that if we increase the energy, the attenuation will decrease. If we decrease the energy, attenuation will increase. Attenuation is nothing but it is the change in the intensity of the X-ray beam. Dexa is a C-arm machine with the patient lying in the supine position and X-rays coming from below at two distinct energy levels specific for soft tissue and the cortical bone. A collimator is situated between the patient and the X-ray source to minimize the scatter radiation. So the machine sends a thin invisible beam of low dose X-rays with two distinct energy peaks through the bones being examined. One peak is absorbed mainly by the soft tissue and other by the bone. The soft tissue amount can be subtracted from the total, and what remains is a patient bone mineral density, which we call as BMD. This is the basic structure of Dexa. From the below, the X-rays are coming and it will hit the patient. That X-rays will be detected with a detector. We have source followed by a shutter, then source collimator to reduce the radiation, then scanning table on which the patient is lying. Then X-rays will go to and hit the detector. We have detector collimator and the photon detector. And finally, we will get an image. By seeing the T-score, we can tell if the patient is normal or he or she is having osteopenia or osteoporosis. If the value lies between 0 to -1, it is normal. If the values lies between -1 to -2.5, then osteopenia, or below 2.5, then it is osteoporosis. This is a Dexa machine. We have buttons which will move the C-arm in right and left direction, and patient will lie in the center of the table. Before the scan, we do calibration. In calibration, a phantom is scanned and the scanner result is compared to the phantom. After positioning the patient, the scan will come like this. After the scan, these lines are set. This line shows the region of interest and the region for BMD. We have certain guidelines like who should undergo the scan. All women, like all the postmenopausal women, should undergo the scan. Men of age group 50 to 70, if they have the risk factor present, they should go for the scan. Adults with a condition or taking a medication associated with low bone mass or bone loss, anyone being considered for pharmacological therapy for osteoporosis, anyone being treated for osteoporosis to monitor response to the therapy. If the patient is having the symptom of hyperthyroidism or he or she is severe obese, then we will scan the 1/3 of the radius. This is all about the DEXA scan. I hope you find this informative and thank you for your patience listening.